Hi everyone, today we are talking about abuse, preventing, recognizing, and reporting abuse. As home health professionals, we often are the only eyes and ears inside the patient's home. That makes us uniquely responsible to make those observations. Abuse is not always obvious. It may be subtle, gradual, or even hidden behind family dynamics. Reporting is not optional, it is legal, and it's your ethical duty as a caregiver to report it if you see it or suspect it. So, why does this matter? Abuse can happen in any care setting. Home health workers are mandated reporters, so we're the first people that may see something different. Early recognition protects the patients, and reporting can save a life. So some of the objectives: by the end of this training, you will be able to define abuse, identify the types of abuse, recognize the signs and the risk factors, understand reporting requirements, and apply the prevention strategy. So this training is not just about knowledge, but it's about the responsibility and the action. So what is abuse? Abuse includes both actions and inaction. Neglect is abuse, ignoring someone's needs is abuse, intentional harm, failure to prevent the harm, exploitation, and neglect of care. This occurs in homes, facilities, by family members, caregivers, or others. Types of abuse. Many patients experience more than one type at the same time. So there's physical abuse. This could be pushing, shoving, or pinning someone. Emotional, psychological abuse. Examples would be gaslighting, monitoring someone's phone calls. Sexual abuse, of course, unwanted touching or forcing someone to perform any sexual acts. There's also financial exploitation, taking someone's money or government benefits. This is common in elderly abuse. Neglect, failure to provide adequate food, clean clothing, or safe shelter. And then abandonment, leaving a dependent person home alone for extended periods of time without a way to get help. When looking at physical abuse, we have to look past the injury itself and look at the narrative. One of the biggest red flags is medical shopping. This is when the abuser takes the victim to a different hospital every time, so doctors don't see a pattern of injury. Also, pay attention to the caregiver's behavior. Are they refusing to let you speak to the victim alone? Are they answering every question for them? Physical control in the room often mirrors physical abuse at home, so pay attention to those. So some of those examples: hitting, slapping. This include non-marking strikes like hitting like the top of the head, like places that you can't see with the your visible eye. These are places that you have to go look for. So on top of the head, the soles of the feet, restraining improperly, using soft ties, bed rails, or even furniture to strap someone who doesn't need to be confined. Over medicating, using chemical constraints because you're sedating them, using antipsychotics to make a patient easier to manage rather than for a medical diagnosis. Withholding necessities like denying them food, water, or the use of the bathroom as a form of physical punishment. And again, some of those signs are bruises, like patterned injuries, bruises that look like handprints. It could be like a belt buckle or even cigarette burns. The defensive stance, like flinching at sudden movements or loud noises. Frequent accidents, a history of frequent trips to the ER for falls or clumsiness. And then clothing mismatch. Wearing long sleeves or turtlenecks in hot weather could be that they're trying to hide marks. Next, we're talking about emotional abuse. While physical abuse leaves bruises, emotional abuse leaves scars and that psych. It is often described as brainwashing. So a key indicator here would be isolation. If you notice a friend or a patient suddenly cutting off contact with everyone but one person, that is a massive red flag, a big red flag. The abuser is removing that safety net, so the victim has no one to turn to for that reality check. So remember, just because you can't see the injury doesn't mean the trauma isn't life-threatening. Emotional abuse is a leading predator of long-term clinical depression and PTSD. So examples of that would be yelling, threatening, humiliation, isolation, gaslighting, lying to a victim about past events to make them doubt their own memory or sanity, economic threat. If you leave, I'll make sure you're homeless and the kids hate you, or something like that. Some of those signs are withdrawal, loss of self. Again, that person stops having hobbies. You stop having opinions. You notice their personality changes. They don't have their own personality, and they change it to avoid conflict. Depression, fear around specific people, that checking in habit, like constantly checking their phones or needing to ask permission for basic tasks like buying a coffee or going to the bathroom or eating food. They have to get permission for simple and basic things like that. Emotional abuse is like a slow drip. Like, you might not see it like one big explosion. It's a slow drip of like insults and control that eventually fills up until the victim is drowning. So you want to make sure you pay attention to those particular signs. If you see someone that looks like they're just sinking into their own skin, like they're drowning, that's a big red flag that they're dealing with some emotional abuse. Next is sexual abuse. So when we talk about sexual abuse, we have to talk about vulnerability. So abusers often target those who have limited communication skills or those who might be viewed as unreliable witnesses due to their age or cognitive decline. So this happens very often in the elderly community and with children too, with children with disabilities. One of the most telling signs is sudden fear of care. If a patient who was previously calm suddenly becomes hysterical or combative during a routine bath or clothing change, we have to ask why. Remember, you are not the detective. Your job is not to prove it happened, but your job is to recognize and report it. So if you see these signs, the window for collecting that evidence is very small. So immediate action is vital. Those examples: unwanted touching, like grooming behaviors. Boundaries are slowly pushed over time. Exploitation, forced exposure, forcing them to undress in front of others. This is common in institutional abuse. Signs: torn clothing, bloody or torn undergarments. They may have frequent urinary tract infections or genital injuries. Financial exploitation. So in Louisiana, our Silver Alert system and adult protective services are seeing a massive spike in exploitation. It's important to realize that the exploiter is rarely a hooded hacker. So 90% of the time, it's someone the victim knows and trusts, like a family member or even a neighbor. Watch for the new best friend syndrome. If a patient suddenly changes their will or hands over their debit card to someone they just met like 3 weeks ago, that is a red flag. Also, look for financial grooming because that's a thing too. This is when the abuser slowly convinces the victim that their family is only after their money, so that the victim turns over that control and the victim ends up getting a hold of their money and their account, pretending to be the safekeeper. By that time, the family realizes what's happening and the accounts are often drained. So look for those examples and those signs: stealing money, forging checks, misusing their debit cards, missing belongings, unpaid bills, and sudden financial changes. Then we have neglect. Some of the examples of neglect will be poor hygiene, untreated wounds, dehydration, malnutrition, unsafe living conditions, piles of trash just everywhere, lack of running water, or no AC, no heat. And these things could, especially no AC, can be critical in these Louisiana hot summers, based on the last couple of summers that we've had here in Louisiana. That AC would sure come in handy. So pay attention to those signs with those unsafe living conditions. Medical neglect, skipping dialysis, and you are not there to help encourage them. Now, the patients do have a right to refuse, but you can't make that decision for them. So skipping dialysis or failing to give the patient what they need, like heart medication, diabetes medications, things like that. They may have pressure sores that are stage 3 and stage 4 with strong odors, living in or sleeping in feces. Those are types of neglect. Next, we're going to talk about risk. Who is at risk? In Louisiana, we do have a high population of homebound seniors living in rural areas. This creates a perfect storm for abuse because isolation is the abuser's greatest tool. When we look at patients with dementia, we have to be their voice. They might not be able to tell you, my daughter hit me, my son pushed me, but they might show you through aggressive resistance, like screaming or shrinking away when that specific person enters the room. We also have to consider the caregiver's profile. Is the caregiver someone with their own history of abuse? Is the caregiver, someone with a history of their own substance abuse or untreated mental illness? When you pair a vulnerable patient with a high stress or unsupportive caregiver, the risk is like a blow up. It's at an all-time high. Vulnerability isn't just about the patient's diagnosis, but it's about their environment. So dementia and cognitive impairment, physical disability, isolation, dependent on a caregiver. When the abuser is the only person providing medication or financial management, the victim may stay silent out of fear that they will be sent to a nursing home if the caregiver is removed or something bad will happen to them. Warning signs in the home. So abusers, again, when you walk into the home, use your senses. Does it smell like decay? Is there a foul smell? Is the fridge empty or full of expired food? Look for those unsafe environments: spoiled food, medication mismanagement, caregiver refusing private access to the client or patient. The patient appears fearful. If you can't get 60 seconds alone with the patient, you should be concerned. Next, we have reporting abuse. So if you witness it, suspect it, hear about it, you must report immediately, follow agency protocol, and document objectively. Remember, you are a reporter, you're not a private investigator. Your goal is to provide the who, what, when, and where. But you never want to confront the abuser. This can put the victim in extreme danger once you leave the house. So your job is to document, make sure you document the facts, and let the APS, which is the Adult Protective Services, handle the investigation part. Documentation, which is very, very important. Objective findings, which means what do you see? Not what they say, what do you see? So objective findings would be a bruise or a cut, a scrape. Those are some examples. Patient statements, their exact quotes. You want to put their exact quotes. Do not assume, do not diagnose abuse, and do not accuse. You only document factual stuff and using factual language only. So every citizen here is technically a mandatory reporter for elder abuse. But as healthcare professionals, we are held to an even higher standard. A common fear is, what if I'm wrong and I ruin a family? The law specifically protects you as long as you aren't making a report maliciously or lying. You can't be, you just can't be sued or prosecuted for doing your job. Important distinction: if your patient is in a private home, you call EPS or APS. If they are in a licensed facility like a nursing home or long-term care facility, you call LDH, Health Standards Section. If the situation is an immediate life and death emergency, bypass the hotlines and just call 911 first. So again, your mandated reporters, nurses, CNAs, home health aides, caregivers. You are the mandated reporters. Preventing abuse. So prevention starts with us by educating families on caregiver burnout, setting clear professional boundaries, and practicing person-centered care will reduce the friction that leads to abuse. So remember, you might be the only person that patient sees all week. Your documentation and your courage to speak up are their primary line of defense. So education, clear boundaries, caregiver support, prevent the burnouts, and person-centered care. Now to the best part, we're going to do a little review. Let's test our knowledge. So the first scenario, you visit Miss L. She has multiple bruises. Son answers all questions. She avoids eye contact. Son refuses private conversation. What do you do? So let's look at this case. At first glance, the son might just seem overprotective or deeply involved. But look closer at the combination of signs. So how would you try to give Mrs. L, how would you try to get Miss L alone without making the son suspicious? So you can say something like, I need to perform a physical assessment that requires privacy. It's our agency policy to speak with the patients alone for 5 minutes to complete our chart. Something like that. So that's a way to get them along. But what else would you do? You would document and report it. Document and report it. Scenario 2. So scenario 2, Mr. J has severe bed sores, no repositioning schedule, soiled bedding, and dehydration. Is this abuse or neglect? So I'm going to paint a picture here because these are real life situations. This happens. So in this case, a caregiver could be saying, I've been trying my best. It's just so hard. I'm trying my best. I have not slept in days. I'm trying my best. I'm just very tired. So it's easy at first to feel sorry for them. But does the caregiver stress mean we don't have to report it? No. Your answer should be no. We report because Mr. J is in danger. Neglect is the most common form of abuse that's reported. So reporting isn't about punishing the caregiver. It's just about giving Mr. J the resources he needs, which might include professional home health or transition to like a higher level of care. So your answer would definitely be neglect, and you must report it. So let's check our knowledge, and this is interactive. You can pause it if you wish. So number one, if you suspect abuse, should you wait for proof? 2, can emotional abuse be reported? 3, is neglect considered abuse? And 4, should you confront the caregiver? So the questions and the why. Number 1, if you suspect abuse, should you report it for proof? That answer is no. So in Louisiana, you only need reasonable cause to believe abuse is occurring. So if you wait to report it, or if you wait for proof, the victim may be suffering. Number 2, can emotional abuse be reported? Yes, it can be reported. While it's harder to document emotional abuse, but emotional abuse is recognized as a category under the Louisiana's protective statute. So it often serves as a gateway to physical violence or financial theft. Number 3, is neglect considered abuse? Yes, neglect is considered abuse. So legally, the failure to act is treated with the same level of seriousness as a harmful act, which will be the physical abuse. So both require immediate reporting. So yes. Should you confront the caregiver? That answer is no, never. You should never, never, never confront the caregiver. Confrontation can escalate quickly. The danger for the victim once you leave the premises. Confrontation can escalate the danger for the victim once you leave the premises. Once you leave that patient's home, you never know what can go down. So it also gives the abuser a chance to hide evidence or to groom them, to tell them what to say, to the victim, to lie or move the victim to an unknown location. You never know. So you don't never want to, don't play the hero or the big bad guy. You don't ever want to confront them. You are not the detective. So go with your gut. If your gut says something is wrong, then something is wrong and you have the right to make a phone call. But you do not need to go and play Magnum PI. You don't need to do any type of investigation. So never play the hero. So our key takeaways: abuse must be reported immediately. Multiple forms can occur at once. You are a mandated reporter. Prevention includes caregiver support, and documentation must be objective. This concludes our training. Until next time, you have a wonderful day and a wonderful evening. Thank you.